Hello, I'm your host, Neil Howard, here on Health Professional Radio. In studio with me is Mr. Shawn Singh, CEO of Vistagen, and he's joining us on the program to talk about their pipeline. That pipeline includes nasal sprays that work kind of like spritzers for the brain. Welcome to Health Professional Radio, Mr. Singh.
Oh, thank you for letting me join you today. It's a pleasure.
Yeah. Give us a bit of your background briefly and talk about your role at Vistagen.
I'm the CEO and the director of Vistagen. We are a public company based in South San Francisco, and we're listed on the Nasal. I've been in this space, the biopharmaceutical space, for about 30 years now.
Is Vistagen involved in making a specific type of pharmaceutical, or are you involved in making anything that fulfills a need?
We are exclusively focused on mental health. All of our drug candidates, we have three differentiated clinical stage candidates that are either in or through phase 2 human testing, clinical testing. And each of those assets is unique in the way that they work compared to current treatment options, as well as the side effect and safety profiles of each of the candidates, uniquely strong relative to a lot of the medications that you typically find in the neurological and neuropsychiatric arenas. Those are the two sectors within the pharmaceutical industry that we operate exclusively.
Well, I mentioned that we were going to talk about one of your products or one of your assets, the nasal sprays. What are these nasal sprays specifically for as they relate to mental health?
Sure. There are two distinct nasal spray candidates. They're first-in-class medicines. They're fundamentally different from all current treatment options in the way they work. One is initially indicated and being developed for social anxiety disorder, and that is called PH10 neuroactive nasal spray. And the second is indicated for being developed for major depressive disorder, or MDD, and that is PH10 neuroactive nasal spray. And these are really, they're unique assets in that the way they work in the body, the way they work in the brain is fundamentally different from all current medications and anything that we know of in development. We have in our nasal passages unique neurons and receptors, and these are what facilitate neurotransmission, the chemical messages in the brain that affect movement and mood and anxiety, speech, all kinds of typical motor skills that let us lead our everyday lives. Well, in the case of PH94B for social anxiety disorder, and this we can go into as a disorder, it's very widespread, especially in the United States, over 20 million people in the United States, third most common mental health disorder. It's a very intense fear of judgment and humiliation in everyday social and work performance situations. So a job interview, going on a date, giving a speech, making a presentation to peers, going to a doctor, typical things that most people take for granted. If you are troubled with social anxiety disorder, these are significant issues. These are debilitating issues, and there's a significant opportunity cost often for avoided situations as a result of SAD. The PH94B is, again, it's a neuroactive nasal spray at microgram doses. Importantly, that's a remarkably low dose, 3.2 micrograms, spritzed into each nostril, 1.6 micrograms per nostril, activates these chemosensory neurons that are only located in the nasal passage. Once that occurs, it triggers a series of neural impulses mediated by a part of the brain called the limbic amygdala that then broadcasts to other parts of the brain inhibitory neurotransmissions or inhibitory messages that inhibit the fear and anxiety impulses that we typically have in a kind of a fight or flight scenario. So at very low doses, you don't have what's called systemic exposure, and that's very important in a lot of ways from a safety perspective. microgram doses, no detectable safety exposure, lets us pivot with this compound in many directions, not just SAD, but also general anxiety disorder, potentially post-traumatic stress disorder, postpartum anxiety. There's a range of neuropsychiatric indications that are associated with this particular part of the brain and the areas of the brain that that these messages are broadcast to.
Now, you say that SAD is the third most common mental illness affecting millions and millions of people. I'm sure that depression in general, not specific types, but depression in general, it would be at least in the top three. Does social anxiety disorder and depression kind of go hand in hand? Can the nasal spray work for one or the other or both?
Well, certainly those are often a match set, unfortunately. Anxiety and depression do typically go hand in hand, especially if you can't wrestle down the anxiety. So let me go back a second to social anxiety. In terms of the current treatment options, really there are only three. And the first is an approved class. Here, the FDA approved three common antidepressants. Those are Xanax and Zoloft, Paxil, and Effexor. These are old school antidepressants, take a long time to work. If they work, very limited efficacy and a lot of side effects. And so for a more of an episodic indication, patients often do not like to have on board in their body chronically these medications for something that really bothers them on and off as situations arise. So the other classes are benzodiazepines, which are also being used, unfortunately, and abused at epidemic proportions in the United States. We have a benzo crisis that's really parallel with the opioid crisis. And then the third class are called beta blockers. Both benzodiazepines and beta blockers are used on an off-label basis. They're not approved for SAD by the FDA. So if those don't work, often subjects will go to alcohol, unfortunately, and try to control their SAD that way, which leads to risky and potentially abusive behavior. So PH94B comes into a field that is occupied by really completely white space in terms of an FDA-approved drug for rapid onset treatment of social anxiety disorder. And that's the key feature that these drugs are delivering is we are seeing efficacy in phase 2 studies within 10 to 15 minutes of taking PH94B. So it's self-administered as a nasal spray, often upfront of a challenging social or performance situation. And within 10 to 15 minutes, that anxiolytic or that anti-anxiety effect is generated at a statistically significant level. So we're very excited about the potential of PH94B to be the very first FDA-approved, on-demand, fast-acting, and safe anxiolytic for social anxiety disorder. Once that occurs, we hope that will follow with additional indications. Now, depression requires a completely separate pathway. In depression, you need excitatory activity. So the distinct molecule we have for that is called PH10, and that is, again, a neuroactive nasal spray, and we also have an oral drug, a pill, called AV101, which works on a different neurotransmitter. So there's no one-size-fits-all for depression, and many different neurotransmitters and many different mechanisms of action must be involved for patient care. And unfortunately, for the last 20 to 30 years, we've really had just about the same old thing. Many different serotonin-based drugs, norepinephrine-based drugs, all essentially the same neurotransmission pathway, and that needs to change. So the new generation of drugs has a fundamentally different approach to depression, either in our case through PH10 and the chemosensory neuron pathway, or AV101 through what's called the NMDA receptor.
Well, where can our listeners go online and get some more information about Vistagen and your pipeline?
Well, as I mentioned, we're a public company. NASDAQ listed, the ticker is VTGN, and our website is Vistagen.com.
Shawn, thank you. Appreciate your time this morning here on Health Professional Radio.
My pleasure. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, with Mr. Shawn Singh, VistaGen's CEO. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download, and SoundCloud. And be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.